Hi. So let's have an important topic. With the help of just only one image, we can review here the basic physiology of thyroid hormone synthesis, what are the basic anti-thyroid drugs, and a very small bit about two important pathologies. Right? So you know that basically thyroid hormone synthesis requires iodine. But initially, iodide. This is the basolateral membrane where from the blood circulation iodide is taken up into the thyroid follicular cell. So this is the thyroid follicular cell. So iodide is taken up into the cell with the help of a protein called Na plus I minus symporter. Okay, right. Then once the iodide gets into the thyroid follicular cell, again it needs to be transported from the thyroid follicular cell into the lumen. So this is your lumen of the thyroid follicular cell, actually thyroid follicle. So here this I minus will be first initially transferred from follicular cell into the lumen with the help of a protein called, and in exchange you will get one chloride. I'll just draw this here for better understanding. So I minus comes in into the lumen and Cl minus will come from the lumen into the thyroid follicular cell. So this transport protein is called I minus Cl minus antiporter, right? So this is also called actually pendrin. This is called pendrin. All right, then. So once I minus comes into the lumen of the thyroid follicle, it needs to be changed or it needs to be oxidized to I2. So what happens here? I minus is converted to I2 with the help of an enzyme called thyroid peroxidase, right? So once the I2 is ready, it will go and bind with tyrosine. If one iodine molecule binds to it, it is called monoiodotyrosine. If two iodine molecules will go and bind with tyrosine, it is called diiodotyrosine. And you know the math. So MIT plus DAT. Monoiodotyrosine, when it binds to diiodotyrosine, that is called T3. When one DIT binds with another DIT, it is called T4. Now, if diiodotyrosine in a reverse manner goes and binds to monoiodotyrosine, it is called a reverse T3. Now, all these things will go and attach to one important molecule, that is nothing but your thyroglobulin. As you can see, MIT, DAT, T3, T4, even RT3 also part of it is bound to thyroglobulin. Once thyroglobulin is ready with all these things binding to it, now it will be transported from the lumen into the cell with the help of a protein called magalin. All right. So once it comes here, part of these molecules will be deiodinized with the help of an enzyme called deiodinase, where this part of this iodine will be deiodinized and it will go into the circulation of again thyroid hormone synthesis. Whereas T3, T4, they are released into the circulation. So as you can see here, so this is the blood vessel. Let's imagine. So this is your blood vessel. Once T3, T4 comes into the blood circulation, they'll not be free. They'll be binding to either albumin or prealbumin, which is also called transthyretin. So it can be prealbumin or it can be thyroid binding globulin. So these thyroid hormones T3, T4 are bound to this either of these three important binding proteins inside the blood circulation. And whenever thyroid hormone needs to show its action on the periphery, the majority of the portion of thyroid hormone will be in the form of T4. And when it needs to act on a peripheral target tissue, it will convert into T3 by the help of again an enzyme called deiodinase. One iodine molecule is getting eliminated, that's it. Okay, so this is nothing but your deiodinase. So this T3 will go and act on the peripheries in the nuclear receptors. All right, now this is the brief review of thyroid hormone synthesis. Now let's look at what are the important anti-thyroid drugs we have, right? Okay. So first one is one group of drugs will act on this particular Na plus I minus importer protein. So they will go and inhibit this kind of Na plus I minus importer, and these group of drugs are called thiocyanates. So one is, you can remember with the help of mnemonic PPT, PPT, perchlorates, pertechnitates, then T. This is T. So thiocyanide. Okay. So these are the three important groups which will be acting on Na plus I minus importer. Now there are group of drugs which will act on thyroid peroxidase enzyme. So they, you can remember with the help of MPC. M for methimazole, P for propylthiouracil, C for carbimazole. Carbimazole is nothing but it is the prodrug of the drug methimazole. All right. Now, what is the antithyroid drug of choice in case of pregnancy and in non-pregnant females? These are all the important questions you need to remember. So normally propylthiouracil is hepatotoxic. That's why usually the antithyroid of choice in normal non-pregnant ladies is your methimazole. Usually we use carbimazole. So in pregnant females, in T1, like first trimester, you will go for propylthiouracil because your methimazole or carbimazole, they are teratogenic drugs. That's why usually in first trimester of the pregnancy, where your organ formation and all is happening, their antithyroid of choice is your propylthiouracil. In non-pregnant ladies, usually we come across something called carbimazole. I mean, we use them commonly, methimazole, right? So these are the three important drugs that will be acting on thyroid peroxidase enzyme. Now, the other important things which will be acting as antithyroid drugs is your Lugol's iodine. So which will act with the help of Wolff-Chaikoff effect. Then there are important group of drugs which will be acting on deiodinase, where the peripheral conversion is inhibited. You can remember these with the help of ABCP. So A for amiodarone, B for beta blockers. Most important is your propranolol. Then C for corticosteroids, P for propylthiouracil. So as you can see here, propylthiouracil, it inhibits both thyroid peroxidase enzyme as well as deiodinase enzyme. Okay. So these are the important antithyroid drugs we need to remember with this. Again, with the help of same single diagram. Now, if we look at pathologies, let's say for example, for the thyroid hormone synthesis to occur, you need TSH receptor. So whenever you have got autoantibodies developed against this TSH receptor, that is your Graves' disease. Now, whenever you have got autoantibodies against thyroid peroxidase enzyme or even thyroglobulin, so this is nothing but your Hashimoto thyroiditis. Okay, again, easy to remember. You can remember easily with the help of mnemonic. G comes first, H comes next. So if the autoantibodies are against TSH receptor, it is Graves' disease. If the autoantibodies are against thyroid peroxidase enzyme or thyroglobulin, it is nothing but your Hashimoto's. So with the help of a single diagram, you can remember most of the important concepts regarding thyroid. Thank you.